There's going to be many factors that influence whether or not a removable prosthesis is going to be ideal for a patient. And when it comes to the prosthodontist kind of determining whether or not a removable prosthesis is going to be ideal for a patient, he or she is going to be looking at two main factors. First is extraoral, the second is intraoral. Extraoral is going to be those things that are going to be beyond the prosthodontist's control. Intraoral are going to be key factors for recommendations. So looking at the overall health of the tissue, the health of the remaining teeth if a partial is going to be constructed. So it's important to have an idea what both these extraoral and intraoral factors look like and how they are going to affect whether or not a removable prosthesis is going to be able to be tolerated by the patient. So some extraoral factors is physical health. And we know that there are many medical conditions that patients may have that can actually prevent them from being a candidate for a removable, a partial, or even a denture. So we might have to look at other alternative options in that case. We know that certain medical conditions can really do a lot of damage to the tissue in the mouth or even the bone that's remaining or the teeth themselves. So we need to make sure that we're looking at that and taking that into consideration. Also, poor overall health. They may not be physically able to adapt to wearing a partial or a denture. You know, we had a gentleman who insisted on having all of his remaining teeth extracted and getting into a denture. We, tried to talk him out of it many times. Finally, he was adamant about doing that. We were able to do it because the condition of his teeth weren't the greatest. We probably could have probably saved maybe a few of them and put him into a partial. That probably would have been better for him. But he was adamant about taking the rest of them out, and so we did. Unfortunately, once we were doing the impressions and everything else, he was a very bad gagger. And once the appliance was made, he unfortunately was not able to even wear the denture because it gagged him so badly. We would try to put it in, have him sit there for a few minutes. The minute the denture was put in his mouth, he would start gagging and had to take it out. So unfortunately, I left roughly around that time, so I don't know whatever became of him. I don't know if he was able to ever wear and get used to wearing the denture. But again, that's something to take into consideration. We just don't really know, what a patient can and cannot tolerate until that time comes, and by then it's too late. So at that point, maybe implants would have been suggested to him just to be able to have something in his mouth to be able to eat. But also, medical condition, we don't know the dexterity of the patient. If they're suffering from Parkinson's disease, they may not be able to physically themselves put a partial or a denture in their mouth without having some help. So that also does factor into the decision as well. Mental health, how stable is the person that we're going to be placing an appliance, a removable appliance, going to be? Are they going to be irritated trying to put something in their mouth all the time? Are they going to be able to maintain the appliance? Once it's there, you don't just put it in your mouth and forget about it. You do have to take it out and remove it to clean it, to rinse your mouth out, and to make sure that you're allowing your tissue some time to heal and to breathe, to avoid getting candidiasis or infections in the mouth. And so, we need to make sure that they're going to be able to do that properly, and it's not going to damage any other remaining teeth, or it's, going to be something that, they're going to end up with a lot of infections because they're not able to properly take care of it. Patient motivation is obviously a huge one. We see a lot of patients that, their teeth are in bad shape, they're embarrassed, they are possibly in pain, and they are obviously very motivated to have something different. They don't want to be in pain anymore. They want to be able to smile again and not be embarrassed when they're talking to people. So that is definitely motivating for patients to want to get it done. And also just letting the patient know that, once the teeth are removed, there's no going back. We can't put them back in. So they have to really understand that they're getting something that's replacing their natural teeth. But, again, what's being replaced might be better than what they have, especially if majority of their teeth are broken down at the gum line. Then it's not really doing them any good anyways. But again, just letting them know that, a denture or partial is not going to work as well as their own natural teeth would. So their chewing ability may decrease slightly. Age, looking at the person's age, if they're a very young person, then we may have to design the partial in a manner that if they happen to lose teeth over time, it's something that can be added back into the partial rather than having to remake it every time they lose a tooth. If it's a denture, then we need to make sure that we let the patient know that over their lifetime, they may have to have several dentures made just because, once the tissue heals and shrinks, and just over time, the wear and tear of not having any teeth in the bone, the ridge tends to recede a little bit, and the denture that they currently have may not fit the way it should, preventing them from really eating and talking in the way that they should. So that's definitely going to play a part. Also, what's the patient, what are they doing? What's, their lifestyle? We had a gentleman who wanted to have a denture made, and we found out that he was a trumpet player. Thankfully, the condition of his teeth weren't too bad that we were able to save some of them. And instead of doing a denture, we did a partial. Had we given him a denture, he probably would not have continued to play the trumpet like he wanted to. So having a partial made definitely helped him continue to do what he loved to do, and that was play his instrument. Again, sports, what kind of sports, is the person involved in? And we need to make sure that we're taking that into consideration. And, some patients are really embarrassed because they may be in their, early 20s, late 30s and needing a denture. And, that can, really play a part in a person's ability to, maybe they, because people usually associate dentures or partials with being old, whereas they're still fairly young, and now they're needing to have these appliances to help them. So again, just talking with the patient and getting a sense for where they are, and letting them know that, what they're going to have in an appliance is better than what they're currently dealing with. They're going to be able to eat better. They're going to feel better just by getting some of those teeth that are not in good shape out of their mouth. Dietary habits, very important to talk with your patients about what their dietary habits look like. Are they constantly eating and drinking sugary things? If so, we need to make sure that we talk with them about that and try to encourage them to look at other options when it comes to what they're eating and drinking, because that can play a part in their gum tissue, in the bone itself as well. So we want to make sure that, what they're doing at home is not going to affect them being able to accommodate or wear a removable appliance. Social and economic factors, there are some patients that really don't care that they're missing teeth. They seem to get by very well, and it doesn't seem to bother them that they're missing any teeth. Obviously a person like that, we're probably not going to convince them to get anything removable, especially if they've been functioning in that manner for several years. And there's others that it really bothers them to have missing teeth, and they want something, they want to know options when it comes to replacing them. Also, ability to pay for any kind of treatment. Removing teeth and getting a removable appliance is very costly, and a lot of patients don't have that kind of money to, unfortunately, to spend on their teeth. So oftentimes it gets neglected, unfortunately. So that is definitely going to be a major factor in, letting the patients know up front what that's going to look like, and allow them to have time to sort of think about what it is that they want to do. And there are some things out there available to patients. Care Credit is a great one. It acts like a credit card. They can get interest free for, up to a year, sometimes longer if they qualify. So there definitely is some help and assistance out there to help patients who may be of low income, or things like that. We've had where people's the congregation or the church that they belong to, raised money to help a patient get some dental work done. So things like that do happen. I know some people set up a GoFundMe account to allow people to pay in and provide them with this ability to be able to afford dental work, especially removable and appliances. Occupation, what does the patient do for an occupation? Are they, do they deal with the public? Do they not? That can definitely influence whether or not that might be a good option for a patient. And then, if, for a denture especially, we would oftentimes encourage patients to remove the teeth and allow 2 to 3 months of healing before a denture was made. That way, when the denture was finally made, it would actually fit very well, having had the healing time to do that. But again, if a patient is working in the public, unfortunately, they're not going to be able to do that. So things like that, do factor in options that we are able to provide for our patients. Intraoral factors that are going to impact definitely musculature, muscles of the face, because like I mentioned before, when the patient, especially with the denture on the lower, they're going to have to sort of retrain their muscles in their cheeks and their tongue to assist in helping to hold the appliance in place. So that's definitely going to be an issue. Is the person have frenums that are pretty low, that they might have to do a frenectomy prior to doing any kind of a prosthesis? How active is the tongue? We don't really think about that sometimes, but if a person, has an active tongue, then that could, prevent, or that could, possibly have them pull the denture or the partial out constantly as they're either talking or whatnot. So that comes into play. And also any unusual facial habits. That can also cause some difficulty. If a person, again, some sort of medical condition, maybe they've had a stroke, that, one side of their face is a little bit more droopier than the other, then they might not have the appropriate muscle strength to be able to accommodate. Salivary flow, anything that you put in your mouth stimulates the flow of saliva, and putting an appliance in the mouth is no different. So the patient may complain of, having more saliva that they're having to deal with. They might notice that they might be spitting as they're talking a little bit more because of that excess saliva flow. And just to tell them, that that's going to be normal. And again, if a patient has had a stroke, it may be a little bit more difficult to be able to control the amount of salivary flow. Usually over time, as the patient gets used to it, then the saliva glands stop secreting so much saliva. But sometimes in patients who maybe have had a stroke, that's, unfortunately not going to be the case. Or the lack of saliva. We know that certain medications and conditions can result in xerostomia, dry mouth, which then prevents the patient from producing saliva, which that could be pose a problem, because as they're trying to talk or eat, they might find that their lips or cheeks are kind of sticking to the appliance, which can definitely be a little uncomfortable for the patient. And residual alveolar ridge is very, very important. Without that ridge, it's going to be very hard to put a partial or a denture on top of that. That's definitely something that the prosthodontist is going to be looking at, because we don't want it to, prevent the appliance from sitting on it appropriately. They'll always check each side to make sure there's no rock in the partial or the denture, because again, as the patient occludes or starts to chew, we want both sides to be even. If not, it's going to result in some sore spots for the patient that we're going to have to try to take care of. So that's where the adjusting comes into play. And if there is not enough ridge there, then they might have to be referred to a periodontist or an oral surgeon to have an alveoloplasty done, where they're basically recontouring the bone the alveolar bone to be able to accommodate some sort of an appliance to sit on top of it. Oral mucosa, if the ridge has been again altered by either a physical condition or something going on with the appliance itself, then it can cause irritation, leading to sore spots, leading to it being uncomfortable for the patient. So again, that's where they might have to come in several times in order for us to take care of those pressure points or sore spots that need to be relieved from their prosthesis. And this is going to happen in both dentures and partials. Usually once we see or deliver a denture and a partial, we usually get them back within a couple of days just to kind of make sure and do some adjustments, because more than likely the patient's going to have some sore spots. Again, the patient's not used to having something sitting directly onto their tissue, so it's going to probably cause a little bit of irritation until they kind of get used to it. Oral habits, what are their oral habits? Do they clench? Do they grind? That's definitely going to factor into whether it's something they're going to be able to have, and maybe some things that we might need to look at in the design of the partial especially. And are they mouth breathers? That's again can lead to xerostomia and can lead to the appliance not fitting very well in the patient's mouth. Tori, we know tori can definitely prevent any kind of an appliance from being able to sit very nicely along that ridge. Oftentimes, if the tori are pretty severe, then we recommend either an osteectomy or an alveoloplasty or alveolectomy, where they'll actually remove and recontour the bone to allow again for something to fit on top of it. This just kind of shows you what that tori kind of looks like prior to removal surgery. And again, tori like this is definitely going to have to be removed. This is showing you palatal tori, not very common. It's more common to have mandibular tori than palatal tori. But even here, you can see that to be able to accommodate on the top picture here, a denture, especially with how bulbous this tissue is back, or this bone is back here, it's going to prevent this patient from getting that suction that's going to be required to keep their denture, maxillary denture in. Same thing with here, with the tori on the palate itself. There is no way that an appliance, a denture or partial, can be made because this is going to restrict how that's going to sit on there. So these would be indications to have surgery to remove those. And again, this is just to kind of give you a sense for what a removable partial denture looks like. In this case, this patient, it's a maxillary denture, and the only teeth this denture is or this partial is replacing is some of the anterior teeth here. This patient still has some posterior teeth, but you can clearly see the major connectors right here. And then you have your rest that's on this area here, and a rest here, and also another rest right here, and two more back here on these second molars right back here. And again, these don't impede or interfere with when the patient closes or bites together, because they've created enough of a divot or a indentation in the tooth to allow it, when that partial is in, that it's sort of flush, and it doesn't interfere with when the patient is biting or chewing.